Hello everyone. Welcome to Yashoda Hospitals online segment, the Health Talk session. We are here today to talk about hypertension and its preventive measures. Do post your queries on our social media platform and we'll get them answered by expert doctors here. I'm Dr. Lakshmi and let's welcome Dr. Pawan Poddar, Senior Consultant Cardiologist from Yashoda Hospitals, Malakpet. Welcome, sir. So, sir, these days the word hypertension has become very common in everyone's life. What do you think is the cause for this?
As you rightly said, hypertension is a common problem nowadays. In every household, we will have one or two individuals or more who will be diagnosed with hypertension. There are multiple causes for hypertension. One important cause is that it is a hereditary problem. There are multiple genes which can lead to diagnosis of hypertension. So, a person can inhibit one or more of these genes. So, it is not a single gene disorder, there will be multiple genes. So, how many genes we inherit, that will increase our likelihood of developing hypertension. Apart from this, there are several secondary causes for hypertension, that is another disease leading to hypertension. Most common among these are the kidney disorders. Generally, people who have kidney disorders, whether it is a chronic kidney disease or other kinds of kidney disorders, they will develop hypertension. There are other rare endocrine disorders also which can lead to hypertension.
So, do post your queries related to hypertension and we'll get them answered by expert doctors here. So, taking the next question, we have Mr. Sharath from Hyderabad. He wants to know which is more dangerous, high blood pressure or low blood pressure?
Yeah, this is a good question. Actually, both high and low blood pressures are dangerous, but low blood pressure is more dangerous. Many times people feel that if their blood pressure is 90/60, if their blood pressure is 100/70, that is low blood pressure. But patient will be absolutely all right, they will not have any symptoms. This is not what is low blood pressure. Low blood pressure patient will be very sick, they will require admission into ICU. And there are few medicines which can be given only in the injection form which can raise the blood pressure. So, low blood pressure is one where patient is severely symptomatic, they cannot stand. There are a lot of other conditions which can lead to low blood pressure, like a severe infection which we call as sepsis, and there will be other conditions also, a severe heart condition where the heart becomes very weak, then patient develops very low blood pressure. This is what we call hypertension. But a normal walking lady with a blood pressure of 90/60 or 100/60, that may be the normal blood pressure for her, that we don't call it as low blood pressure, that doesn't require any treatment. High blood pressure on the other side, it can lead to other problem if it is untreated for many years. Sometimes high blood pressure can lead to kidney problems, it can lead to development of heart problem, it can lead to development of brain stroke. So, that is why high blood pressure also needs to be taken care of. Now, the question is what is high blood pressure? Generally, there are a lot of societies which have issued guidelines regarding diagnosis of hypertension, but for the common public we should assume, we can say that if the blood pressure is consistently or on many occasions if it is above 140/90, then we call it as a high blood pressure. In certain patient subset, the threshold for diagnosis is at a lower level, such as in diabetic patients or in patients who have kidney disease, then we label hypertension as when the blood pressure is more than 130/80 millimeters of mercury.
So, sir, talking about high blood pressure, we have young adults these days being diagnosed with high blood pressure. So, what do you think the cause for this could be?
Yeah, when we have a diagnosis of hypertension in younger people, by younger people I mean people who are below 30 years of age. So, in those subset of patients, if a patient is diagnosed with hypertension, then we have to look at secondary cause for hypertension, that is there may be some other underlying disease which may cause the hypertension. So, here detailed workup is essential in this subset of patients. As I already said, the kidney diseases are the most common cause of hypertension in this subset. Patient can have blockage in the vessels which supply blood to the kidneys, which we call the renal arteries. That is another important cause of hypertension in the young. Apart from this, there are certain endocrine disorders, disorders of the hormones in the body, such as we have acromegaly, or there are certain hormones related to the thyroid and the parathyroid gland, hyperthyroidism, hypothyroidism, hyperparathyroidism, they can also cause hypertension. There is one disease involving the great vessel of the heart, the aorta. There is a constriction in the aorta, we call as coarctation of aorta, that can also lead to hypertension. So, when we have a diagnosis of hypertension in the young patient, we should look for all these causes in such young patients.
So, when someone young is diagnosed with blood pressure, high blood pressure, are there any dietary modifications they should consider?
Yeah, dietary modifications should be considered not only in young patients, but all patients who are diagnosed with hypertension. We have to reduce their daily consumption of salt or sodium. The recommendation is that if we consider salt, they should consume less than 6 grams of salt per day. By salt I mean sodium chloride, and when we take into consideration the amount of sodium they should consume, it should be less than 2.4 grams per day. Apart from that, we recommend that all hypertensive patients, they should consume a diet which is rich in potassium. They should consume lot of raw fruits and vegetables, and they should also undertake some form of aerobic physical activity. That is, they can either go for a brisk walking, they can do cycling, they can do swimming. Some of them who are interested in some form of dance such as Zumba and all, they can do that. So, a diet which should be less in salt, it should be more rich in potassium, along with some sort of regular physical activity is advised for hypertensive patients.
So, taking the next question, we have Mr. Anil asking us from Kurnool. He says that he is 20 years old, but his blood pressure is 140/90. He wants to know if it is normal.
Blood pressure of 140 over 90 for any age group of patient, it is not normal, it is in the borderline range. So, when a patient is having a first time recording of blood pressure of 140/90, what we need to do is we need to monitor the blood pressure for few times. We need to see if the blood pressure is persistently above 140/90. If we have many readings over 140/90, then along with the recommendation, dietary recommendation, we need to start him on medications also for hypertension. So, blood pressure of 140/90 is borderline, that is where the cutoff the threshold for starting treatment. So, if it is above consistently above 140/90, then we need to start the patient on medications.
So, sir, what are the common symptoms related to high blood pressure that one should keep a check on?
Yeah. Most of the time what we see when the blood pressure is mildly raised, by mildly raised I mean systolic blood pressure of 140 up to 160 millimeters of mercury. So, when the blood pressure is mildly raised, what we see most of the time patients do not have any symptoms. Some patients can complain of headache at this level of blood pressure, and if the blood pressure is very significantly raised above 160 or above 180 millimeters of mercury, then many times they complain of severe headache. Apart from this, if the hypertension is long standing, if it is present for more than 5 years, sometimes patient can develop permanent changes in many important organs of the body. They can develop some blockages in the heart vessels. Sometimes they can have symptoms related to that. They can complain of chest pain on walking, breathlessness on walking. Sometimes they can develop kidney problems also, and they can show symptoms related to kidney diseases. They can have swelling in the feet, swelling on the face, and breathlessness. These are the symptoms of the kidney disease. Sometimes they can be symptoms related to blockage in the brain vessels also.
So, sir, apart from the symptoms, what are the long-term complications of high blood pressure if left untreated or ignored for a long time?
Long-term complications of high blood pressure include most importantly, it can lead to development of kidney disease. If blood pressure left untreated over a period of time, what we see, patients' creatinine starts increasing, and they develop symptoms related to the kidney disease. Another important long-term complication of hypertension is development of brain stroke. This brain stroke can be because of brain hemorrhage, or it can be because of development of clot in the brain vessels. And the third most important complication of long existing hypertension is development of blockage in the heart vessels, that is what we call as coronary artery disease. So, many of these patients may present with a heart attack, that is myocardial infarction. Apart from this, long standing hypertension can also lead to visual disturbances.
So, taking the next question, we have Mrs. Sirisha from Karimnagar. She wants to know if blood pressure is genetic.
Yeah, blood pressure is definitely genetic, but it is not a single gene which leads to development of heart hypertension. There are multiple genes which can contribute to the development of hypertension. So it is polygenetic inheritance, what we call, not a single gene. So our chances of developing hypertension depends on how many of those genes we have inherited from our parents, either father or mother. If we inherit a lot of genes, then there are more chances of developing hypertension, and that too at a younger age.
So taking the next question, we have Mr. Abhinav. He wants to know that he was recently diagnosed with hypertension. For how long should he continue taking the medicines for this?
Yeah, this is a very important question. What we see many times when people are diagnosed with hypertension, medication is started, they start taking the medication, and once the blood pressure comes under control with the medication, they stop taking the medication. That is not the right way to go about it. What we should understand is that hypertension is a long standing disease. We cannot cure it totally by taking medication for a few days. We can keep the blood pressure under control by taking the medications. But as soon as we stop the medicines, most of the patients again they are going to have high readings of blood pressure. So blood pressure medications needs to be taken regularly for long term. Most of the patients will need to take lifelong medications. Though the medications needs to be adjusted or they needs to be changed from time to time by your treating doctor depending upon the blood pressure levels. Sometimes the same medication may not effectively control the blood pressure after some years. So at that point in time we have to either adjust the dose or we have to change to some other molecule. So this we need to understand. We need to take medications regularly to keep the blood pressure under control.
Because many a times we have seen that many patients are non-compliant to the hypertensive medicines and they stop it by their own, thinking that the blood pressure is being controlled. So what advice you would like to give them?
Yeah, to prevent this from happening, nowadays it has become very easy to monitor your blood pressure. Lot of apparatus are available in the market which are very easy to use and through which you can check your blood pressure at home. So nowadays we advise all patients for self monitoring of blood pressure at home. So this serves as a check. Suppose if the patient misses a medicine for 1 or 2 days, then he checks the blood pressure at home. He will realize that even missing a single dose or 2 doses also will shoot up the blood pressure. So this goes a long way in ensuring compliance of medication for most of the patients. So that's why we advise them to purchase one of these electronic apparatus which are readily available and to monitor their blood pressure at home periodically.
So sir, talking about treatment, are AC inhibitors contraindicated in COVID patients according to few studies which were done earlier?
No, AC inhibitors and ARBs are an important class of antihypertensive medications. Earlier there were some concerns that the COVID infection is increased in patients who take this group of molecules. But a lot of studies, lot of very large studies involving thousands of patients have been done, and it has been found that these medications doesn't increase our chances of acquiring COVID. So any patients who are on this antihypertensive medications, they can continue to use them even in this COVID pandemic. They don't have increased susceptibility to develop COVID if they are on these medications.
So taking the next question, we have Mr. Suraj from Silguri. He says that his father was recently diagnosed with hypertension and he wants to know if that is a risk factor for him to get a heart disease or a stroke.
Yeah, blood pressure is an important risk factor for the development of heart disease. People who have high blood pressure, they have 2 to 3 times high risk of developing a heart attack or coronary artery disease. So it is very important to take care of our blood pressure right from the beginning. So if the blood pressure remains untreated for a long period of time or poorly treated for a long period of time, then most of these long standing problems related to hypertension develops. So that's why it is very important to keep one's blood pressure under control right from the time it is diagnosed.
So sir, talking about hypertension and its complications, how should you think the pregnant woman should keep their blood pressure in check and what symptoms they should be looking out for?
Hypertension is also a common anomaly which we see in pregnant female also. There are 2 categories of hypertension in pregnant females. One category is one where the lady has a pre-existing hypertension and then she develops, she conceives. Another category is one where the concerned lady doesn't have pre-existing hypertension, and hypertension develops for the first time during pregnancy. This is what we call as pregnancy induced hypertension. So, there will be a lot more patients who develop pregnancy induced hypertension during pregnancy. So, the most important thing in this category of patients is that we should advise them dietary restriction. We should advise them to take less salt, and they should be advised to take rest in the left lateral position at least 2 hours in the afternoon also. So, this decreases the pressure of the uterus on the blood vessels, and this also helps in lowering little bit of blood pressure. Apart from this, what we should understand is that lot of medications which are used in the treatment of hypertension, they are not safe, that they cannot be used during pregnancy. So, there are only 3 molecules which we use for the treatment of hypertension in pregnancy. Another important thing is that people who develop this pregnancy induced hypertension, if their blood pressure is not controlled, then they can throw a seizure or a fit either during delivery or in the postpartum period, that is after the delivery. So, it is very imperative for us to keep their blood pressure under control.
So, sir, considering the current pandemic scenario, we have many patients neglecting or postponing their general health checkups. So, what advice you would like to give them?
Because of the current pandemic, we know it is very difficult to visit a hospital for many of patients who have chronic diseases and which are under control. So, what can be done by these patients? With regard to hypertension, I feel most of the patients nowadays, they have a home monitoring device. So, what they can do, they can monitor their BP in the house. If their BP is within the target range, which is below 140/90 for most patients, so they can continue taking the same medications that they are taking. If most of these readings are not in the target range, that is more than 140/90, then they can have a teleconsultation with their doctors, and their doctors can adjust the medications. They can adjust the dose, or they can put add some other medication. So, that is very important. We should not stop the BP medications because of our inability to go to the doctor for regular follow up, because once we stop, BP is going to shoot up and it can lead to long standing problems with hypertension.
So, this brings us to the end of this session. Hope all your queries related to blood pressure were answered. Do join us on our next session next Sunday. Stay safe and take care. Thank you.